in healthcare here? Who's interested in healthcare? Okay. You can raise your hands higher. Lucas. Okay, that's better. All right. So we have today a senior person from Kaiser Permanente. Who's a Kaiser Permanente patient? A lot of people. Okay. So Karin Cooke is the director of Kaiser Permanente International, and she formerly was a director in their Tech Innovation Fund. And I actually met Karin because I had a whole bunch of very tall Dutch entrepreneurs here in Silicon Valley, and they were all, healthcare entrepreneurs. So I took them on a visit to the Kaiser Permanente Innovation Center in San Leandro. And, Karin and I aren't that tall. And then we had all these super tall Dutch guys. It was a lot of fun. But I was, actually, I'll show you a picture later of one of them. But the thing about it is, when I was listening to Karin present and talk, I'm like, this is some super high level executive person at Kaiser. But there was so much she did that cared about the community, that cared about the underserved people. And she is a great example of showing compassion amidst capitalism. And so I really wanted her to come talk. And can you believe it's Valentine's Day and she's leaving her husband at home to come to be with you? Aww. So, Karin, do you want to come up? Let me put in your presentation.
I should say that our Valentine's Day tradition is always after Valentine's Day because we don't do Valentine's in restaurants at things. But I do have my kids waiting for me at home because I promised them a special dessert. So that's I will be leaving after this to get home to my kids. So as we pull up the presentation, I went to Berkeley. I met my husband here, and my parents met here. But my husband actually works for Kaiser too, in a completely different world than I'm in. And today, what I thought I would do. So some of you know about Kaiser Permanente. Some of you get healthcare there, but you might not know kind of what goes on behind the scenes. Hopefully you don't, because hopefully if you get care from Kaiser, you walk in and you get good care and you feel better. Ideally, you don't even have to go in, right? Like you're not too sick, you can email a doctor, hop on a video visit, and be on your way. But what I'm going to do is talk a little bit about how we're organized and how we're bringing, how our mission really drives what we do. So my background, I went to Cal, I was working in education, I went back for my MBA at UCLA, it's always second to Cal. And then I was working in some venture philanthropy organizations, and I decided, at some point I was like, I just want to be in healthcare. And so my husband had actually been at the Garfield Innovation Center for Kaiser, and he said, you have to work there. That's where you need to work. And a job opened up for kind of an internal venture fund manager at Kaiser. And so that was the job that I started Kaiser with, which was basically entrepreneurship. We were able to take great ideas from doctors, nurses, business leaders at Kaiser and try to make them come to life. And we got to try those out, test them out a lot at our innovation center. And then about 5 years ago, I switched to KP International, which is Kaiser's, we have a social mission, and we really believe in how we practice care and foster total health. And so we try to share that internationally. And so there's a lot of focus on innovation and how we're thinking about the future of healthcare. And so I now spend my time meeting and working with international groups, helping them think through it. You know, it's a universal challenge trying to provide healthcare for populations, whether you're a private healthcare company or you're a government. So thinking through those challenges together is always really inspiring and insightful. So let's see. Okay, that's good. So I'll start a little bit about our history, and then I'll talk about our structure, because that's what's really unique about Kaiser Permanente in the United States. I'll talk a little bit about health plan, but mostly just where we're located. And then really talk about some of how we've looked at integrating technology to improve our healthcare delivery. Thank you. And I'll end with a little bit of what we call community health. And it's so much why it's, Kaiser Permanente, something like 90% of the employees are proud to work at Kaiser Permanente. And a lot of it is because of the work that we do in the community, and that we are able to take part of it, and that it's part of our job to be giving back to the community. And that was something when Gigi brought the Dutch group, that was like, this would never happen. And, they're different countries. They do a lot. The government does a lot more support maybe in the community. But, it is a core foundational principle for Kaiser. So we've been around since 1945. Our mission is to provide high quality, affordable healthcare to our members and the communities we serve. And that's different, because we are saying we operate in communities. We operate here. We have a new medical office in Berkeley, just down the street from here. So maybe for those of you who are members, maybe you've gotten care there. I've heard it's very nice, though I haven't been. We know we have an impact in the community, and we want the communities we're in to thrive and be healthy. And so that means we look at, how do we build up small businesses in the community? How do we make sure that people have food? How do we make sure that the air quality is not bad? I mean, many of our hospitals are located in communities near freeways. Well, the air pollution is far worse. How do we address that? How do we help our members stay healthy? And so that is all part of our mission and how we think about healthcare. So from the beginning, before we started, our model was pretty unique, and it started really in the 1930s. And this is when Dr. Sidney Garfield, he was a surgeon, he's our founding doctor, and he was asked to start a health clinic at an employer work site. And he was asked to care for employees when they had accidents and injuries on the job. And so he started this health clinic, and he quickly realized it was totally not financially sustainable. There was no way he could do this. And so he was speaking with Henry Kaiser and Henry Kaiser's team, and they said, well, why don't we just prepay you? There's this employee population. We're just gonna pay you each month to care for this entire population. And then he was like, okay, this works. And then he said, well, now I want to prevent people from getting sick. How do I take care of this workplace and make sure that no one's going to get injured from like falling objects and sharp things sticking out? And so he went around and figured out, okay, how do I avoid, falls and cuts and all these things? And so then he really focused on prevention, but then he thought, shouldn't I just take care of the whole person, not just an accident and injury? Because they're also getting sick. But healthcare wasn't as widely available back then. This was in the 1930s, that he was doing this. And so he said, I could charge, it was something like 5 cents a month, but like 5 cents a month to cover total health for the employees. And everyone loved it. And then he said, but you know what happens? Their families come in when they are really sick. And they need to be in the hospital, but they don't have health insurance. So they just come to me as this last resort. And he's like, I can care for them too. And so he took this like employer health clinic and made it into this full healthcare operation for the employees and their families. And Henry Kaiser loved this. And he said, well, would you start this at the Cooley Dam for us? And will you do it at the Hoover Dam and all these different construction projects? And then it was at the Richmond shipyards, just 10 miles from here during World War II. Henry Kaiser's great innovation was being able to build those big warships in 3 days. And he was wanting to take care of all his teams that were building those ships during World War II. And so Sidney Garfield was hiring his different doctors to partner with him and building these health clinics at all of these different construction sites. World War II ended, and Henry Kaiser and Sidney Garfield said, we like this model. We like this prepaid healthcare. We like that we focus on prevention, and we like to take care of the whole person. And so they decided, let's launch this company. And so in 1945, they officially launched this health plan and provider organization where it's care and coverage together. So you have your insurance and you have your own network of doctors and all the associated facilities and pharmacies all in one organization. And so the innovations that started in the 1930s and were officially pulled into this company in 1945 were that we prepaid for healthcare. You pay in advance and your healthcare is just covered. Then that led us to focus on prevention and total health. If you are a Kaiser member and you have not gotten your flu shot yet this season, I am sure you are still hearing from Kaiser. They love to remind you to get those vaccines, your prevention screenings, and it's all this prevention work that we truly believe in. And we really want to keep people out of the hospitals. No one wants to be there. And so how do we keep people healthy and well? The other thing is Dr. Garfield was a surgeon, and he knew he needed to learn from other types of doctors so that he could care for everyone. So he really liked this idea of practicing as a group, an interdisciplinary group. And so that's how he was designing these systems. We really believe in a population-based approach. How do you care for a group of college students who all have particular ailments? Maybe you all get sick over the holidays, right? After a stressful, busy semester and finals, and you all get sick. What do you do? Or maybe it's, how do we get you all to have flu shots? And that's helpful for the community at large, as well as you as individuals. It's also about, how do you care for diabetics or patients with cancer? And we're very interested in how do we learn the best way to care for particular populations and then tailor that for each individual member. And from the earliest days, they were very focused on clinical information technology. Are any of you in data science or statistics, math, any of those things? Yeah, so the fifth doctor hired was a medical informaticist. And his thing was we need all this data, any data from a medical record, and we need it computerized, and we need to look at it and analyze it. And so we were starting to put medical record data into big mainframe computers that I think took up whole big rooms. They were huge back in the 1950s. And so we were really at the forefront of that, and we measure everything. My husband's actually a statistician or data scientist at Kaiser in one of our research groups. And it plays a big part in how we deliver care. And finally, equity has always been at the core of what we do. And I'll share this, that, during the war, everyone was in the effort to prepare the US for the war. And so more and more people were in the workforce. And when we opened our hospitals, Henry Kaiser was like, well, everyone gets treated here. But at the time, many hospitals were still segregated, and not everyone had access to all the hospitals. And here, this was in 1946, where a lot of our first members were unions of some sort. And so there were police officers who had come to visit a hospital, and they said, the police chief said to me, when we walked through, I saw that you had some blacks and whites in the same room. I don't think we like that. As I can recall, I responded, do you know this plan started that way with blacks and whites in the shipyards? And that's the way it goes. They worked together and they were sick together. I told the police chief, those who don't like it shouldn't join the plan. And that was, in our second year, and it's been a firm commitment that we provide care to everyone who comes through, who wants Kaiser Permanente insurance. And our big emphasis now is reducing health inequities. And what does it mean to make sure that no matter what race, what socioeconomic status you are, you can have the same health outcomes as the person who's getting the best health outcomes. Okay, so what makes Kaiser unique is that we are an integrated care health system. Are you all familiar with that? You heard of that? Okay, so US Healthcare 101. Most of US healthcare is fee for service, meaning you have PPO, right? You get to go choose your doctor and you pay for whatever care you're provided. And maybe you go and then you go for a visit, they say, oh, you actually need an x-ray. Oh, you actually need lab work. And you pay, or the insurance pays for each additional service or touch point. And at Kaiser, you pay your premium and it covers everything. You have copays. And now, depending on what plan you have, there's different copays, different costs. But the idea is that it's not fee for service. It's not how many touches you have. It's your care is covered, and that's covered by the premium you pay. And what makes this work is that we're all aligned. So most doctors are paid by almost volume. How many doctor's visits did you have? How many x-rays did you do? How many labs did you order? And in our model, our members buy insurance through the health plan, which is there in the middle. And then the health plan says, okay, I'm going to work with our medical groups, which are the Permanente medical groups, and I'm going to work with our hospitals, which is all of our medical facilities and our IT, and we're going to agree on a budget for the year. And we're all going to say, this is how much we think it's going to cost to take care of our members. And then each entity has a different budget. And so that means, hospitals are generally money makers, right? Actually, in the US health system, hospitals are some of the loudest voices that determine what our policies are. And so hospitals are large money makers. In Kaiser, they are cost centers. We own most of the hospitals that we operate, and we're operated on a budget. We do best when our patients are getting the care and treatment that is expected for their condition. If they stay longer than expected, that's not good for us. It means they don't have the outcomes we expected, and they're staying longer, which is using more resources. And we want them to have the best care. And if they aren't getting it, that's a sign if they're staying longer than expected. Our doctors are also salaried, meaning they don't get paid more for doing more, and they don't get paid less for doing less. They are salaried, and they are incented to care for the whole patient. And that's very unique. It is not the norm. We serve about 4% of the US population, and we are the largest private integrated healthcare system. So it's a small portion of the US that actually gets care like this. There's a few other systems, Geisinger in Pennsylvania, Intermountain in Utah. I just heard that St. Luke's in Idaho has started an integrated plan. So a few more are developing, but it's it's definitely not the norm. So this is how we are structured and how we work together. And we only see Kaiser Permanente members, and our Kaiser Permanente members see Kaiser doctors and go to our facilities. And that's also unique. We often are challenged with a sense of, well, I lose choice. And it's true, if you're in a PPO, you can choose any of your doctor. At Kaiser, you could choose a Kaiser doctor and we have a lot of doctors. In Northern California, I think we have 9,000 physicians. So it's quite an extensive network. And one thing to point out is that our health plan and hospitals are nonprofits, meaning that it's a business code. It's a business structure that allows us to, with revenue we get, we actually give a portion back to the community. So I think last year we gave more than $3 billion back for community health. And that's a lot of the community health work, which includes affordable housing and environmental stewardship and food security and so many other initiatives that we have. So just for size, 12.6 million members, 23,000 physicians, almost 220,000 employees, 39 hospitals, a lot of medical offices, and research studies. We're doing research just a tremendous amount all the time. It's increased since COVID because we were the first company doing trials of Moderna, the first vaccine. So we've had a lot of studies and publications about that. So this is where we're located. You're in California is where we started, where most of our members are. If any of you are from around the country, we're in a few other places, but predominantly West Coast with our membership. Okay, so I laugh at this. I'm sharing this blue sky vision, which is, it's actually 20 years old. And I remember when I started at Kaiser, and I've been there for a while, when I saw this, I was like, isn't this outdated? It's like, really? I can't believe this. And then I was like, it's not. It's like where we're at. It's so much about where we're at and kind of where we landed, especially with the pandemic. So it was actually the 1990s were not a great decade for Kaiser. We really struggled. We're often called a health management organization, not always popular here in the US. And so we, leaders at the company were like, we got to do better. We don't want to be middle of the road. We want to be an excellent healthcare company. So they came up with this blue sky vision for the future. And it said, we're this integrated company. We should be providing the best care possible, and it should be seamless, and it should be meeting the customers where they want. And this was a huge paradigm shift because medicine has always been about the care teams. What do the doctors need? What do the nurses need? And we were saying, no. We have to think about what the patient needs, what the consumer needs. And so this was a huge shift for us. And we said, okay, the consumers are at the center. And we believed that everything we did needed to be secure and seamless. It's a healthcare journey, and we needed to make sure that everyone just transitioned seamlessly through all the different touch points in healthcare. And we needed to be customized. We have membership cards, and people were like, I don't want to be a number. I want you to know me. And so we said, well, how do we get there? And then we really needed to leverage our integrated system. We have all these facilities, and we weren't always connected, and we weren't always operating as one. And finally, we actually believed, even though I think at that point we were like the largest private real estate developer in California, we were like, people don't want to come to our buildings. They want to be at home. So how do we make home the hub of care? And so this was our blue sky vision. I share it because it took us a while. It was supposed to be through like 2015. But really, the home as a hub is a really, I'd say that we achieved a lot of that, but home as a hub is still emerging, and we're still advocating today because COVID allowed us to do a lot more care at home, but we have to advocate for regulations that actually make that possible in the long term. So what did all this transformation do? It made us look at our quality and how we got better at care. And so we just started this continuous quality improvement, team-based care. That doesn't happen unless you're in like a large medical group, but we're saying, if you have diabetes, you have a doctor, but you're actually going to be talking to a dietitian or maybe a pharmacist or maybe a case manager who's helping you manage all your chronic conditions. We also have proactive encounters. So if you go into a Kaiser Permanente facility and you're there for maybe just an annual checkup, sports physical, something like that, they'll say, oh, you haven't had your flu shot. Let's get you that today. And so we're trying to say, if you come in, let's make it as impactful as possible. Data-driven, we really measure everything. And I'll talk a little bit more about that later. Relentless research, we're trying to understand what is the best way to deliver care. And we're super focused on how do we bring that into operations. We automatically enroll people into disease management programs, so they get this whole care team wrapped around them to support them as they try to manage their health, keep their diabetic, their A1Cs in control, or manage their blood pressure. And then we also do a lot of remote monitoring. So helping our members keep track of their chronic conditions from the comfort of their own home, and the data just seamlessly gets to our care teams. So, one of the things that, thinking about working as an integrated system, there's this amazing doctor I work with, Tatiana Kolevska, who has been leading our cancer care redesign. And she's like, we have 23,000 doctors. There are so many oncologists. We need to become experts in 150 different types of cancers and be able to be our second opinions and leverage, the doctors who are based in Georgia to help the oncologists in California when they have specialized knowledge. And we have the most prevention screenings of any health plan in the United States for breast cancer, cervical cancer, and colorectal cancer. And we just published a study last year that if you are a Kaiser Permanente member and you have cancer, you are 20% less likely to die a premature death than if you're not a Kaiser Permanente member. And so we've really found ways to help prevent cancer, screen early. And so we're able to treat people at earlier stage and extend their survivorship years. And it's actually been greater outcomes for Latino and Black patients. So we're actually really reducing some of the health disparities that exist for those members. And this was all made possible because we invested earlier than most health systems, in a medical record. We use the Epic platform, if anyone's familiar with electronic medical records, and we spent a lot. We spent 6% of our revenue on this. Most healthcare companies at the time were spending 1% to 2%. And we just made this bet that this was how we needed to connect our system and have all the information and use that information to provide better care. And so we have 84% of our members on our kp.org, which is our patient-facing platform. And so that's how they communicate with their doctors. That's how they log into video visits. That's how they get their lab results and schedule appointments. And so this has been a game changer and allowed us to have real-time data to see how are we doing with quality? What changes do we need to make to get better outcomes? So the Health Connect, it has all of your labs, it has what prescriptions, it has everything in one place. I had a friend who became a Kaiser member and she's like, oh, that's so weird. I went to see some doctor and they knew everything about me. And she's like, but I'd never seen them before. And I was like, well, you'd seen their colleague. And she said, but everyone knows everything. And it weirded her out. And she had never experienced that. And then a year later, she's like, oh, it's so amazing. Like everyone's connected and knows what I need at any given time. But that's part of what the medical record does, is your whole care team has access and can assist as needed. So a big thing that we're known for is being very digitally focused. And so when I started innovation, I was there and I was figuring out, how do you do virtual visits? How do you have a doctor in her office providing remote physical therapy at schools, 60 miles away? And we were trying to figure out, how do you do that? How do you do that in a secure way, a patient-friendly way? Who needs to be on each end? What's the technology? We were also just figuring out how to make the electronic medical record easier to use. How do you reduce the number of clicks that a doctor has to do each day? And now, I've been at Kaiser. This is my 15th year, and what's really is exciting for me is that my time in innovation, the innovations that we led are now like our standards of care. And so one of them is this e-visit. And this started with doctors saying, well, we get people calling into the nurse advice line for pretty standard things that have very specific symptoms. It might be an ear infection or a urinary tract infection. If you have a history of them, there are clear symptoms that exist that if you were to say you had them, you're like, oh, well, it sounds like this is what you have. So this e-visit basically takes our clinical protocols and just makes it self-service. And if you complete the survey, what are your symptoms? Sometimes you have pictures. They have the one for pink eye or conjunctivitis, and you have to pick a picture of what your eye looks like. I don't know. I always pick that example to demonstrate, and I always get it wrong. I don't know what it is, but you select all that, and then a nurse or a doctor reviews this and determines what's the next steps. You might just get a prescription because you have, based on your history, your current data, and your symptoms that you just shared, you can get a prescription. You can have a same day delivery, you can have it mailed home, or you can pick it up at one of our pharmacies. Or maybe you need to chat with a doctor, or maybe you need a video visit with a doctor. And so that e-visit just allows you to the example was when we were testing is if you have a urinary tract infection, you don't want to be in the office talking about your symptoms where your colleagues can hear. So how do you do it when you're just on the computer? It's all, you just get to type it in, you have some privacy, and you get it all taken care of without leaving your desk. So, but the e-visits really took off during COVID because this is how we handled everyone who needed tests and vaccines. And this is how we helped everyone find the right place to get care. We also have, well, you could come in person, but many people still want to visit via video. And you can see we just have huge volumes of people, and everyone loves to email their doctor. That they love to email their doctors. And actually, internationally, some companies are actually starting to charge patients for emailing their doctors. That seems to be a trend definitely in Europe. That is not something that is happening as much here in the US, and definitely not at Kaiser. But. So one of the things that launched in, I guess, late 2021 is this Get Care 24/7. So we're saying you basically could get virtual urgent care 24/7. And what was really unique about this for us is we're not located in all 50 states, but we actually have many employer groups who purchase insurance for their employees and their national companies. And with COVID, we could be anywhere. everything was remote. We didn't have to be working in Berkeley, California. We could be in New York, but Kaiser isn't in New York. So what we did here is we created an intelligent routing system to assess symptoms and also help triage and get you to a doctor who's licensed to practice in the state where you're at. So we now have doctors who are licensed in all 50 states. And so when you call, you get routed to the doctor who is on call at that hour, who can practice in the state where you are actually in. So it's a great kind of AI technology and smart routing, and it really expands our coverage because we're located in I think we're in 8 markets, but I think that's 10 states. And so now we can actually cover all 50 now, which is a big change for Kaiser. So now I'm going to share this kind of brings my journey at Kaiser full circle. So one of the last projects I worked on in innovation was related to mental health. And mental health, there's a huge kind of mental health crisis. There's far greater need for support than what we actually have to offer. There's not enough mental health providers, and there's a huge stigma. Many people won't even get help or don't know who to ask or where to go. So we said, we believe that 1 in 5 adults who could use some support do not get it. And is there a way that we can help those members who, and they may not even have a clinical diagnosis, but they could benefit from some mental health support? And you can imagine there's all these people that, and all these quote bubbles are thoughts from members. And so some of them might have a little political connotation, and that is member voices, not ours. But seasonal affective disorder, it's been raining a lot lately. That is a real thing, and people might need support when that happens, but not sure that they're going to make an appointment. And often it's hard to find someone to provide the services. So what we did is we worked with members, we worked with psychologists, psychiatrists, therapists to say, what can we do? And what we ended up doing was identifying a mobile app formulary. We evaluated hundreds of kind of mental health and wellness apps and figured out the ones that fit within how we practice mental health. And we figured out how to prescribe them to our members. And we also created all these other resources kind of for self-service. Then the pandemic hit, and there was huge demand. And people didn't want to come into an office for therapy, even if it was available. And so within 2 months, we were able to take 2 of these apps that had just been rolling out slowly until then and make them available free of charge to all members. And so now you log in to the website, you select the app you want, and then you have access. So right now, we've just added the 3rd one, Ginger, which is actually another innovation project that we had worked on. And so it's fun that this one is actually out for our members to use. But so this whole project came to be, we now have these apps available. So you can download Calm, which is mindfulness, Ginger, which is one-on-one coaching, texting, and then My Strength, which is a cognitive behavioral therapy-based app. And we have great, our whole model and what we know works is when we refer or when we make recommendations by a doctor or a care team member, our members act on it more than having other people offer it. It's that warm handoff from the care team. And so we have incredible enrollment. So when we prescribe mindfulness, we get 57% of people who use the app for at least 3 weeks. And then CBT base is 47%. So Overall, it's 54%. And this was I don't have the updated data for 2022, so this was more 2021, and it just continues to grow in use. So the things that make Kaiser really work is this mission, because everyone believes that we need to focus on total health and prevent people from getting sick. So how do we do that? And how do we help our members stay healthy? Our clinical leadership are figuring out like the best way to do things. We measure everything. We have our aligned structure where we do better when our patients are healthier. So what do we do to keep them as healthy as possible? And we leverage clinical technology. So a big part of our work is this community health. And our CEO, Greg Adams, we've been talking about this for a while. It's these social determinants of health. It's way more than medical care. It is the environment you live in and what influences there are, and whether you have good, stable housing, whether you have food, whether you have just basic needs. And so we have a very robust community health organization, and we're really focused on all the domains, physical, mental, and social. Our latest initiative that isn't on here is that we've started a gun violence research center. And we all know that that's incredibly needed. And if we're not getting things done in the political realm, we need to figure out it's a public health crisis. And so how do we address this? So this is one of the areas that we're working on. And unfortunately, we have more and more data. But we also are in schools, and we provide healthy eating, active living activities. We have invested so much in affordable housing. If any of you have heard of the adverse childhood events study, Kaiser did that, I guess 2 decades ago. And so we're trying to break the cycle of intergenerational trauma and prevent those ACEs from happening. And when they do, how do we help the children heal and not pass on that trauma to future generations? And so where I come full circle is there's a huge mental health shortage. And so Kaiser, as they do, because what they have done since the 70s is when they find a shortage in the healthcare profession, they develop the education program so that they can train people to be in that profession. So 3 years ago, they opened a medical school in Pasadena. The first 5 classes, no tuition, because they want to make sure that finances will not be a barrier for people becoming doctors. And they also started the Mental Health Scholars Academy. And so they give scholarships to Kaiser employees. And so I am back in school in a new degree program that Kaiser started. They have a school in Richmond. And so I'm getting trained as a licensed marriage and family therapist. So and the benefit of it is I still work. I really like my job. Mental health comes up all the time in the international space because this is a global crisis. And, but I have flexibility in my job because I go to school, and I was telling Gigi earlier, on Tuesdays, I'm in clinic from 12 to 8, but I had a cancellation this evening. But so I currently, as part of my training, have Kaiser Permanente clients receiving therapy from me. And this is something that they support both financially and logistically to help us navigate, because we see patients outside of normal business hours. You know, some of my classmates see patients on Saturdays, and I tend to work later in the evening. And so this is a transition, and I love it because I go into the medical record and I prescribe those apps that I was involved in on the front end in the innovation, and now I get to see it where I'm like, oh, you should actually use some mindfulness, and here's this app, and there's some guided meditations. So that's, you know, I think that it's, Kaiser recognizes so many of the challenges we find in our urban environments are, is a lot. You know, 7 of the 10 cities where we're working have the highest homeless rates. right? And so we know we need to get housing, and then most people need mental health support as the second line. And then there's the chronic condition management. So we look at this as what are we doing at the front end? How do we invested $200 million in affordable housing. That included buying some buildings to preserve them as affordable housing. And that also included getting Salesforce and Wells Fargo and other Bay Area companies to put in more money to preserve and build more affordable housing. And then you look at, okay, anyone who gets this affordable housing, they're going to need healthcare services. And what does that look like? And it might be mental health, and it might be food, it might be job services. And so we look at this whole picture, and it's why people stay at Kaiser, because there's this opportunity. You know, for me, I've loved the work that I've done there, and I felt like I wanted to do something more and kind of on that individual level. And I have this opportunity where I still get to do what I love, and I'm learning and will be able to contribute in a different way. And I think that when our international visitors come to visit Kaiser, that's what they're struck by. They're like, everyone, just like, I don't know a company where everyone knows the mission and like has this feeling. And it's a little, it is kind of surprising, but it is pretty powerful. And certainly we have a long way to go. The healthcare system in general is broken, and we need to do our part to help fix it. And I think we really have a good model where we're thinking about the whole person and the whole communities. And it's an exciting space to be in because things are changing really quickly, and there's so much need for innovation. So with that, practice happiness. Okay, you can see the Kaiser Permanente is really harnessing data science to help their patients in the community. I'm just curious because Karin talked about doing gun violence, research. Just curious, I'm just taking a pulse. How many people in here are concerned about gun violence? Amazing. I mean, when I grew up, it wasn't a concern. So now I'd like to turn it over to you guys because, and see what questions you guys have for Karin.
What do you think is like the greatest, I don't know, like the greatest strength part of this? What do you think is like the biggest area?
Yeah, I mean, I think the strength is it has a really strong mission that people believe in. So, we have this integrated structure of doctors, hospitals, health plan together, but we're all separate companies, and there's healthy tension there. Sometimes not so healthy tension, but there is tension as we work together to figure out, like, how do we stay in budget? How do we grow sustainably? How do we do everything? Take those selfies. So fun. Yes. More healthy years. So that's one thing, is the mission is really strong. But I think that we're a big company and there's a lot of bureaucracy. What we found during the pandemic is like, we can move fast. So why don't we do it all the time? I think we have to get out of our own way. And I think it's hard for us, but I think people are motivated because we did do it during the pandemic. And so we should be doing it all the time. And so now we're trying to figure out, how do we get out of our own way?
So any more questions? Yes, sir. Okay, can you stand up and try to be loud so people can hear your question?
So you talk a lot about the early innovation. I was interested in your perspective on the future of healthcare. So if there's one of new models like value-based care
Yeah, so I guess our integrated care model kind of is equal to value-based care. So, the idea with value-based care is that you're really focused on delivering value for the patient with each interaction. And so for Kaiser doctors who are often resource stewards, because they look at it and say, we all go to Dr. Google and we come into the doctor being like, I know what I need, and I need these 3 tests. And the doctor will look at it and be like, yeah, I agree with that one, but I can tell you I get no additional value from the second one. And the third one would only be needed depending on what the first one does. So let's do the first one and then let's revisit. And that's high value care, because in a fee-for-service world, you could go in and do that and you could have all 3. But the Kaiser doctor is like, I don't know, I'm not gonna get anything from the second one, why do it? That's your time, it's our resources, it doesn't make sense. Of course, we have to build trust with members. They have to trust us so that when we say that, they'll be like, okay, I believe that. And I think in general, in the US, we don't have a lot of trust in our systems. And I'd say internationally, man, health systems have the trust of their patients. And that is something that, Kaiser can do more at, and I think generally the US can do more, because then you can have that conversation and say yes to 1, no to 2, let's come back to that 3rd test. So that's really value-based care. And I'll tell you that part of it from a back-end perspective is that if you are a cardiologist, you meet with your chief of cardiology every month and you look at key measures, you look at utilization across the department, and we have it. So every doctor's name is there and you can see who's in the green, like, their patients are managing their hypertension okay, but maybe we're doing too many of this exam. And then we look at it and say, what are we learning from it? And if we aren't learning anything, we say, okay, well, let's go back to this other method. Because we're also believing if you follow the best standard of care, you eliminate waste, which makes care more affordable. So we're trying to make sure that in everything we do, we identify the best standard and we follow that, because that's also the most high value care, because we have to drive the cost of healthcare down. It's unaffordable for too many people. And so we have to figure out how do we keep our costs down so that we pass that on to patients. Yeah.
You spoke a lot about prioritizing health for patients. What are you doing to providers right now?
It's a really great question. I'll just speak personally, like the start of this year and all the gun violence is a really difficult thing in a mental health space. And you sit with people who are really struggling with these issues, and it's a lot. I mean, people are really dealing with so much. And I think the impact of the pandemic, one of the doctors I work with in Southern California, he works primarily with diabetic patients, and he really led the implementation of the remote monitoring program. And I said, how are you? Do you get any rest? What's your world like? And he says, I'm okay, but I think the medical profession will take 10 years to recover. So, the quadruple aim is a big thing in medicine, where you're trying to, effective outcomes and quality and experience. And then it's doctors, like joy and meaning in work. What does it mean for them? And so that's a huge emphasis of all of our medical groups. A lot of it is more flexible schedules. Now that people are more accepting of virtual care, that has been an upside for many, that they can maybe cut down commutes and just have more flexibility in their day. But it's an ongoing challenge. There's the primary care doctor shortage. There's a nursing shortage. And so there are a lot of programs that we're doing to figure out how do we hire more so that we can, maybe have, more backfill. But, one thing that is beneficial about Kaiser, and my friend who was a private practice physician and then moved to Kaiser, it's crazy. Like, you got to learn our medical record system. You got to learn our whole system and bureaucracy. It's a lot. But she says, I have never taken a stress-free vacation before. I never had coverage for my patients before. And now I go and I have a team of 4 people and we cover all of our patients. So we just plan our vacations so that they're coordinated so we always have coverage. And so there's some things that are really great that are just built into the system so people can get time off. But it's a problem, and I do think it'll last a really long time. And I think anyone who's thinking about going into the healthcare profession needs to be thinking about what self-care do you do and how can you help the system be better at it. It's certainly an ongoing challenge.
So, any more questions? Yes.
So, having been in innovation, do you usually have dialogue with the consultants in Europe or Asia?
Yeah, I mean, I personally, with many health systems are wanting to learn from Kaiser, and we also learn from them. So we, one innovation that was created in Netherlands at Radboud University was around how do you care for patients with Parkinson's. And we thought, we love this. Not all of it fits with our system, but we like a lot of it. So we actually brought some of their team over, and they worked with us for a year, embedded in our teams to help us bring that system to Kaiser. So we definitely do that. Right before I came here, I have a group coming from Japan who, they visit our one client I have from Japan. When he visited our innovation center, he went home and he's like, okay, I don't have a full center, but look what I did to this room in the hospital. I made it into this innovation studio, and he sent me pictures of what he did. So we work, right now, some of the countries that we're working with the most are Switzerland, Netherlands, Belgium, France, Brazil, Japan, Canada.
Well, okay. Oh, you can do it. One last question here. Oh, by the way, look here, Karin. Remember?
Oh, yes.
That's one of our Dutch entrepreneurs. He's actually a doctor in Eastern Netherlands. And yes,
they were tall, so tall.
So go ahead.
As you were talking, I was sort of thinking about the possible pushbacks we might get with this kind of position. And I'm thinking of probably would not be on all of these ways to talk to the doctors, and you would get so annoyed if somebody kept being like, oh, get your flu vaccine, I haven't gotten it yet. Like every time you went in and he was making sure not to get it, something like that. Do you guys get that kind of pushback, or how does it work?
Yes, and surprisingly, when we first launched a lot of these digital capabilities, which were, we've been doing we've had video visits since 2015, and when we launched our mobile app, the largest segment, the demographic that used it the most was 64 and older, which kind of makes sense. They probably have more health ailments than the younger ones. And so it helps that we're located in Silicon Valley because, there's a lot of techies here and in California. But we did a project on wound care. And it was, how do we use this device and have remote consultation? And we brought in members. One of the members happened to be my uncle. And we brought them in and we said, imagine this scenario. And they were like, I don't want to be on a video visit with a doctor I have never met before. That's not going to work. And so there's definitely pushback, and there's some way of connecting. We're finding it's changing a lot. When it comes to health reminders, we probably are, many consider us annoying. I mean, this is me. So I was getting health reminders and I was just ignoring them. And then I started to get phone calls, and then I got it. Like, I was like, just stop it, you know, and I know how it works. I know you get emails. I know you get, I mean, I've been involved in this. You get texts, you get emails, you get letters home, and then you get the phone call. And then I was like, oh man, I feel bad. I'm just going to do it. Like, I meant to. But, you know, an example is like a diabetic patient. We want to help them. We know that they'll feel better, but managing diabetes is really hard. It is a lifestyle change. Often when people get diagnosed with diabetes, they also get depressed. It is hard. And so many people are like, I don't want this care team surrounding me. And we're like, okay, we respect that, but only for 6 months or only for a year. I actually don't know the protocol, but if we're responsible for supporting health, we need to help make sure that patients have information so that they can best manage. So I imagine we're annoying to some. I imagine some people just delete those notifications. And then there's me, who eventually I feel guilty because I know the people behind making it happen. I'll be like, oh, okay, I got to prevent that one last phone call. But I am also guilty of ignoring those reminders and getting the follow-up. So yeah.
So what's the message? Listen to it and just do it. So